We started looking into both business practice software and electronic medical records over 10 years ago.
We were looking for solutions from an EHR standpoint to expedite our processing on a daily basis, to potentially decreased costs from a transcription standpoint, and then also from a patient care standpoint to be able to increase the amount of patient care that we were able to give and the follow-up to be able to close the loops.
Virtually every major electronic software system that's out there we looked at. We've looked at over 40 systems rather intensely, and none of them were robust for the kind of things that we wanted to do in primary care. And a lot of that had to do with disease management, integration of data, ways to efficiently look things up. Most systems weren't robust enough.
Because we have a multi-specialty, we like to be able to create our own processes, and so the system allows us to be able to do that and customize it for each individual physician as well as each practice.
Our specific goals with the electronic medical record had to do a lot with some of the committees that were formed, and there were actually some books written about the hope of electronic medical records in terms of improving quality, and where you actually have the data not only organized in a very easily gotten to way, but it actually prompts you to do certain things, and so that you can actually improve quality, so that you can more carefully follow those disease processes. And so we were really looking at long-term, how can it improve quality, all those quality issues.
We decided to go with the Sage Intergy suite because they're one of the biggest players in the system, and we were able to upgrade through, and it was the most seamless of transitions that we could make.
I think our implementation process we felt like went very well. We had a lot of unique areas, again, because we have two different specialties, and when we went from the medical manager system to the Intergy system, we went from two individual practices to one corporation, and so it was meshing. Basically, there was a total of potentially 5 different charts for one patient that we were meshing together, and so that took a lot of coordination and a lot of assistance with trying to make sure that everything came across correctly and that data was merged appropriately. And so again, we had some very good assistance from Sage with regards to that. Within a week of the implementation, most of my staff said they would never go back.
I can't imagine practicing primary care without this system. Since the implementation of our electronic medical records, there's been a huge impact on patient and patient care. First off, we're so much more readily able to get rapidly to data. That's huge. As compared to the paper charts, half the battle used to be finding the chart, locating the chart, filing the chart. Now we get stuff very rapidly into our system, so that we have it now that lab tests and x-rays that I order in the morning are in our records within hours and quickly found.
The patients really appreciate it when I can just go in and say, yes, here's your note from the oncologist, yes, here's your labs, and I can just click through, and they really love the graphing. You know, and I can graph their blood pressures for them, and I can graph their hemoglobin A1Cs or their weight. You know, it's really helpful. Today I had a lady who said, you know, I think I've gained 15 pounds. And I said, well, let me look at your last 20 weights. And, you know, I was able to say, you know, you really haven't. I can see the pattern, and the pattern is you gain weight in the summer and you lose weight in the winter.
Electronic records completely changed the character of a practice. Everything is there and at real time.
The biggest difference I really saw with my workflow was mainly in doing the patient chart checks and the phone calls. The way that we have it set up now, the nurses take the phone calls, they can send me a quick message on the ones that need my input, and I can take care of that throughout the day, and then it gets done a little bit more in a more timely manner.
I hardly ever have to sign my name. Prescriptions are going electronically, and that was something that was a constant interruption, was to be signing so many prescriptions and having this go automatically.
E-prescribing is tremendous just because it keeps a very, very accurate record of every prescription that we do. So it's very easy to go back and say, we prescribed you your narcotics 3 weeks ago and you're a week early for that. Whereas if we were writing the prescriptions, it's a lot harder to keep those exact documentation records.
If we have a black box warning that comes across for a medication, we're able to go in and run a report and customize that to be able to tell us which patients we need to notify that there's been a recall.
In our practice, we have primary care, psychiatry, psychology, asthma, allergy, and diabetes. And each one of those has different templates, but we can put that within the same chart, so it's all very organized, and all that data is ready at our fingertips.
I think the best thing about Intergy is the way that it can be customized. So many of the EHRs that I've seen, you can't do a lot of customization with it. You pretty much have to go with what there is. And I like to be able to make things work the way that I want them to work, as opposed to being dictated to by an electronic health record. So that's my favorite thing about Intergy is, I can make it work the way I want it to work.
The biggest benefit from the practitioner side from the electronic medical record is being able to improve patient care, have ready access to data, have things more efficiently handled, and to then improve the standard of practice so things aren't left out, things are complete, patients are reminded, doctors are reminded, staff are reminded.
Patients with chronic illnesses, compliance is really important, and most compliance studies show that it may be in certain chronic diseases only 30 or 40% of the medication prescribed is actually used.
With diabetes, it's easy to look at the spreadsheets, keep track of what's been done, what hasn't been done.
This morning, as I'm seeing my diabetic patient, it reminds me that these certain things have to be done per the guidelines that we have set up and custom put in our system.
And so much of managing chronic disease is really bookkeeping, of making sure that you've done the appropriate screening and that you've monitored it and you've done what you need to do to deal with those issues.
So the system improves care by being the constant reminder of things without us seeking that out, without us having to prompt it. It prompts us.